In this video, you will learn the importance of an isolation of a sick horse and how to quickly implement the written isolation plan at a competition venue. Stopping an infectious disease outbreak on a competition grounds is essential to protecting the health of our equine athletes and preventing the cancellation of an equine event. The key is early identification and isolation of sick horses. Isolating the sick horse essentially stops the virus or bacteria from being shed in the general stabling and competition areas. Success will be dependent on how quickly and how effectively the isolation plan can be implemented. Delays in the implementation increases the risk of pathogen spread on the event grounds and the potential exposure of additional horses. There are 6 steps to implementing an isolation plan. Step 1, identification of sick horses. Activation of the isolation plan starts with the identification of a sick horse. Horse owners are urged to continually monitor their horses during the competition for any signs of illness, such as a fever, which is a temperature over 101.5, nasal discharge, coughing, changes in eating or drinking, abrupt unexplained changes in fecal consistency, change in behavior or how they move, stumbling, wobbling, unusual aggression, or dragging of the feet. All these could be due to an equine infectious disease pathogen. Thus, immediate isolation for further examination by a veterinarian is critical. Step 2 is communication of such sick horse. An owner must notify competition management or a veterinarian of the sick horse. Once management is notified of a sick horse, the plan is activated and all parties should be notified. Additionally, a designated individual would notify the U.S. Equestrian Federation Equine Health and Biosecurity Veterinarian that a horse has entered isolation. And if it's a reportable regulatory disease that is suspected, such as equine herpes virus, the state veterinarian would also receive notification. Step 3, gathering the resources and setting up isolation. The written isolation plan provides guidance on how to set up isolation, what resources are needed, where those resources are located, or where you need to go to purchase those resources. The dedicated equipment for stall cleaning, feeding, watering, and care are set up and the stall is bedded. Once complete, the isolation stabling is ready to receive the sick horse. To save time and be prepared, events with large number of horses on the grounds for an extended period of time may choose to set up the isolation prior to the start of competition to allow for the quick, immediate removal of a sick horse. Step 4, placement of the horse in isolation. Once the isolation area has been set up, personnel and supplies are in place, the sick horse can be moved to isolation. If multiple sick horses are located in the isolation area, each should be managed separately, meaning all the supplies for one horse should remain in the area of the one horse, and individuals entering the stall should use new PPE such as disposable gloves and disposable coveralls each time entering the stall. Hand hygiene should be performed before and after each horse contact is made. A foot bath with disinfectant should be at the stall entry and used prior to entry and after entry to the stall. These efforts limit the potential for pathogens to be spread beyond the stall area. Step 5, management of the horse in isolation. Sick horses require daily care. Individuals handling those sick horses should be limited. Ideally, the person handling the sick horse is not handling any other horses on the competition grounds. If the individual is caring for both healthy horses and sick horses in isolation, the horse in isolation should be handled last and the individual should leave the premises for the day. However, if the individual must care for healthy horses after being in isolation, the individual should immediately shower and change clothes and footwear before visiting any other horses outside the isolation area. All used disposable clothing and footwear should be disposed of in trash cans in the isolation stabling area. Equipment and supplies shall be designated for the horses in isolation and not be used in any other areas of the competition grounds. This includes feed tubs, stall cleaning equipment, and feed equipment. Any equipment that must leave the isolation stabling area must be thoroughly cleaned and disinfected inside the isolation stabling area. Additionally, to prevent cross-contamination, feed or bedding deliveries should be left at the perimeter of the isolation stabling area and hand carried into the isolation stabling. Step 6. Movement of the horse from isolation. The isolation area is meant to be temporary stabling on the competition grounds. Thus, movement from these stables is necessary. Depending on the horse and the disease course, the horse may be fit enough to travel to home for isolation or to a veterinary clinic for additional care. Care must be taken on the route of travel to ensure disease spread does not occur on the competition grounds. In these cases, care should be taken to plan the route of exit of the horse from the isolation area and the route of transport to limit the pathogen exposure and spread on the competition grounds. Individuals should wear appropriate PPE when handling the horse and any equipment used for the movement, and transport should be thoroughly cleaned and disinfected after use. In the case of a regulatory disease, the horse may be under a quarantine by the state or federal authorities, which means the state animal health official must permit the movement from the isolation stabling to the home premise or to the veterinary clinic. Unfortunately, some horses may succumb to an infectious disease pathogen and may die or need to be euthanized while in isolation. Care must be taken to limit the pathogen contamination of the environment and equipment during the process of carcass removal and transport from the premises. Additionally, if a necropsy is required, the designated veterinary necropsy facility should be contacted regarding the movement of the carcass. In the best case scenario, the sick horse's health improves and multiple test results are negative for infectious disease pathogens. If veterinary examination of the recovering horse indicates the horse no longer poses an infectious disease threat to the competition, they may be permitted to move back to the general stabling area. Successful containment of an infectious disease pathogen, such as equine herpes virus, influenza, strangles, or salmonella, relies on the successful activation, coordination, and implementation of the written isolation plan. The most successful response is one that is planned and everyone works together. Everyone plays a role in an isolation plan. The horse owner or the trainer must continually monitor their horse's health to quickly identify and notify the veterinarian of a sick horse. The veterinarian must quickly assess the sick horse to determine if it is a potential infectious disease case, and if so, notify competition management of the need to isolate. Competition management must have a written isolation plan and trained individuals to implement such isolation plan. The isolation setup team, as well as the isolation management team, must quickly, efficiently set up a safe and biosecure isolation area. The individuals caring for sick horses must ensure all steps are taken to restrict the disease pathogen to the isolation area. To summarize, the 6 steps to successful implementation of the written plan are: Step 1, identification of the sick horse. Step 2, communication of the sick horse to competition management or veterinarian. Step 3, gathering the resources and setting up the isolation area. Step 4, placement of the horse in isolation area. Step 5, management of that horse in the isolation area. And Step 6, movement of the horse from the isolation area. With everyone working together, the sick horse has been cared for, the healthy horses remain healthy, and the show continues. Ultimately, the infectious disease agent has been stopped.